All right, so it might just be us. Renee and JB, do you know each other?
Yes, I'm through
Hey.
phone. How are you?
Finally, like, yeah.
Okay, great. And so we also, Tony Ashton, Prevention Coordinator with the Atom Board. Cassandra, you want to introduce yourself?
I'm Cassandra Woodford. I'm the AmeriCorps Vista member at the Atom H Board.
Great. And Marcy.
Hi, I'm Marcy Fields, the Executive Director at the Atom Board.
All right, so Renee, if you want to talk about signs of suicide and then answer any questions that JB might have.
Definitely. So we've been doing this for a while. The SOS is a universal school-based depression awareness and suicide prevention program. It's designed for middle school and junior high school. It's designed for middle and junior high school and high school students. And the program is listed on the SAMHSA's National Registry for Evidence-Based Programs and Practices. SOS has shown to reduce self-reported suicide attempts by 40 to 60% in randomized control studies. The program helps students identify the warning signs of depression and suicide for themselves and others. It also teaches students to seek using ACT, A-C-T, which is Acknowledge, Care, and Tell. Components include an educational session that includes both a PowerPoint slides and video on awareness of depression, suicide, and general mental health, designed to occur in one class period. A brief screen for adolescent depression, or BSAD, which is now electronic, where in the past it was on paper form, which makes it more confidential. And then individual follow-up with those students to screen positive on the BSAD for possible depression symptoms. Individual follow-up could lead to referral for services, and the school counselors or the contacts at the school get a list of the students who screen positive, and the outcome of the individual follow-up sessions is noted so that they can follow up at school as well. This year, we were able to hire 2 new SOS specialists, and each of us were assigned to specific schools. So in addition to our structured SOS program, we also provided mental health resources and consultation to all schools that are part of the SOS program. Our SOS consultants worked with the schools outside of the direct delivery of the SOS presentation and follow-up, and included resource identification and referral, student and parent consultations, crisis consultation, staff questions and issues, and general awareness and promotion of behavioral health and addiction services. The availability of these additional services to school personnel and parents have received much positive feedback and enhanced the delivery and outcome of the SOS program, as well as engaged staff, parents, and students in behavioral health care services. Due to COVID last year and the year before, virtual presentation and screen were developed, so the program could be provided either in person or virtually. Our program is flexible, and each school tailors it to how they want to use it. For example, some schools decide for the teachers to provide the education, and then we do the individual follow-up, and some schools decide for us to do the whole thing. Schools decide when they want to complete the program, in what format, and how many times during the year. The goal this year was to present to 3,500 students. Currently, we are over 3,500, with 1 presentation still scheduled to occur. This year, we were in 15 middle, junior high, and high schools. We started scheduling programming over the summer for the next school year. The cost this year is $47 per student, and schools can choose to pay some for additional students outside of the Atom Board funding.
Okay, great. So I see Sherry has joined. You want
Hi, Sherry. How are you? I haven't seen you forever.
I know, I haven't seen you either. Do you want to introduce yourself, Sherry?
Sure, I'm Sherry McClurg, and I'm the Director of Student Services with the Fairfield County ESC.
Okay, great. So I would open it up for any questions for Renee about the Signs of Suicide program.
Renee, I guess my biggest concern has always been is the follow-up after the survey. And I guess I'm not trying to throw shade at anybody. I just don't know how thorough it is once that survey is complete. Who is following up with this student? New Horizons or the school?
New Horizons. New Horizons has whoever's doing the presentation, they then follow up that whole week with all the students that screen positive. And then also this year, our person was at your school, it's at the districts, because your schools are connected, on 1 day per week to do additional follow-up after that.
So that 1 day per week is included in that $47 per student.
Yes.
Okay. And how many? So how many weeks after the survey does this take place?
So this was new this year. So the goal is to have each of us are assigned to a school. And then at the beginning of the school year, we work out with the school district as to what day they want us to come on board. So even if we don't do presentations until say January, we still have that person on site before January, 1 day a week. So that if you have any kids that you want them to kind of follow up with, it's not considered therapy, but they are there to do check-ins and just to be an additional support for your school and the students. So if the presentation is done on a Monday, the actual follow-up for those who screen positive would be the entire rest of that week. But they would then follow up with whoever the students are that either you as a school want us to follow up with or who screen positive that would like to be followed up with again. That will last we're there till the end of the school year.
Okay.
1 day a week.
Basically, so it's 1 day a week for the entire school year.
Yes.
Okay.
Yes.
Okay.
And we can do it's mainly whatever the school wants us to do. We're running some groups at some of the schools the 1 day a week. We're doing individual check-ins. We're working with the teachers or the counselors. So it just really depends on what the school district or the school needs or wants.
Renee, is the survey only done one time a year, or is it done multiple times where maybe students who didn't weren't red flag? I don't know if the language was used. I'm sorry, but students who didn't qualify are now suddenly showing signs.
And that's what the thing that the evidence-based program is set up to do 1 time a year. But that's why we decided to enhance so that we're there 1 day a week, so that if, teachers can identify a lot of times, what kid may be having some struggles, even if and here's the thing too, some of the kids aren't honest when they do their actual, their screen. So we know that the school can kind of identify then who would possibly be struggling more, maybe at the beginning of the year as opposed to the end of the year, so that you can let us know and we can follow up. I mean, I have 2 schools myself, and I'll go in and I'll be, first thing they'll say is, hey, can you check in with this kid? They're struggling. It's not someone I've met before, but I'm like, sure, let's talk about it and see what's going on. And we run the gamut between just doing check-ins. We've sent kids to the hospital. We actually get kids into therapy. We'll actually, call around and see who's taking their insurance. And we actually contact the parents and we work with them on trying to get them scheduled. I've actually sat in a room and called the mom, with the kid there to say, hey, is it okay if we do this? And then we call her together and to make an appointment. So it runs the gamut of whatever anybody needs is what we do.
Is that always communicated to the school then, the follow-up issues and calls and things like that? Do we know that, or does it matter to us? Or
well, it's how much the school wants to have the contact. I mean, some schools are a lot more sit down, let's talk about what's going on, what's going on. And then some of the schools just basically want us there to do the follow-up. And if there's any urgent issues or crisis, then that's when we, go and let the school know. So it's really on a case-by-case, school-by-school basis.
Okay. Thank you.
You're welcome.
So we had Kim Miller join. Hi, Kim. You want to introduce yourself?
Sure, thanks. Sorry, I was having my computer updated, so sorry I'm late.
I hear your pain. I know.
My tech guy said, yeah, it was really backed up. It was really bad. I said, okay. Yeah, I'm Kim Miller. I'm the superintendent here at Eastland Fairfield Career and Technical Schools. So I started here last year. This is my 2nd year here at Eastland Fairfield, and I'm new to New Horizons because when I was previously in Bexley and we worked with Cincinnati. I used to live in Cincinnati. We worked with Children's Hospital there. So, but have really appreciated the partnership and the support for our kids. It's been really helpful.
That's great. I'm glad to hear.
And then I see
Hey,
Kathy has joined. You want to introduce yourself, Kathy?
Sure. Kathy Ely, Executive Director of Prevention and Intervention Services with Pickerington Local School District.
So Renee has talked a little bit in general about signs of suicide, and we're just opening up to questions now. If either of you or Sherry or JB have any questions for Renee.
And Kathy, our plan for next year is to continue with our clinicians, not clinicians, but our SOS specialists being in the school 1 day a week, like we were this year.
That's wonderful. It's a great extension, and just being available, because we know even though the signs of suicide is intended for that capturing in that moment, that's not always when things happen. So thank you. That's great.
Thank you.
So any other questions or clarifications for Renee? So I think everybody knows Renee, so you should have her contact information. If you come up with questions, or when you talk with your teams at the school, if you come up for questions, please feel free to reach out to Renee directly, and she would be able to answer any questions for you. I will say that this program, funding wise, is just a little bit different because of how the program is set up. The cost is per student. So that makes it pretty easy for all of you, for schools, because you know how many students you have, depending on what grade levels you're going to place this program. And it's just that number of students times 47 for the cost.
And I also wanted to mention too, that there are some schools, like every school does it differently. There are some schools that do it with every grade, and some schools just do it with health classes. Some schools do it with just one specific grade. So there's no like correct, right way to do it. It's, it's whatever the school district is interested in doing. So I just wanted to mention that. Right.
And it can go anywhere from 5th grade through 12th grade, correct, yes. Renee?
Correct. And we have two separate presentations, one for the middle high school, which would be the 5th through 8th grade, and then the 9 through 12, we have a high school presentation. They're a little bit different because obviously some more mature content can be in the high school one.
Great. Any other questions? Okay, thank you so much, Renee. Our next set of Zoom meetings will happen on Monday, and I put Mid-Ohio Psychological Services and Lancaster Recovery Services together, and so that will happen on Monday, and I'm just getting to my Monday, at noon. So I'm thinking probably 12 to 12:30. And then our next Zoom meeting will be the Recovery Center, and they'll be on Monday from 2 to 2:30. And then after that, Ohio Guidestone from 3 to 3:30. So I'm hoping that you can all get on those meetings. If not, they will be posted to the Fairfield County Adam H. Board website, along with the menu of services. And I know we sent out the large document with all of the services, and then the spreadsheet that can give you a different perspective as you're looking through the programs.
Tony, do you mind sending me an invite to all of those meetings? Because I think I got them piecemealed from Marie, but I'm not sure I got them all.
I can send them to you, Sherry.
Thank you very much.
Yeah, did you get everything else? Did you get the other documents?
I don't know. So if you could send that as well, that would be great.
So actually, yeah, I'll send it all to you, and that way you'll have it.
Tony, has all of this been sent to Dwight Carter?
Yes, we did. I did you and Dwight.
Okay, Dwight's probably going to be the one attending. He's not here today, but he typically would be representing us. But thank you.
Yep. Any other questions for me?
I'm good, thank you.
Okay, great. Thank you so much, everyone. Have a good rest of your Friday and a good weekend.